go.
Okay, so the first thing you do is check your order. So I do have a doctor's order to anchor a Foley catheter now, and then for strict eyes and nose. So I'm done with my order, so I'm going to put it up at my nurse's station, out of sight, out of mind. So I'm going to come in, I'm going to identify my patient, check their name and date of birth, and just explain to them, you know, what a Foley catheter is. That they won't be able to get up and go to the bathroom to pee, that they're going to have some equipment attached to them that is going to drain that urine out for them. Let them know, you know, not to pull on it, not to tug on it, and if they have any problems or any pain to let us know, but we do want to explain to them that they will have some pressure. They will sometimes feel like they have to go pee, but the catheter will drain all that out. So as nurses, that's something that we need to watch for and make sure that that catheter is draining, and if we notice, you know, over a couple hours nothing's being put out, we might need to notify the doctor, okay? So we're going to get our supplies ready. So I know I need a Foley catheter kit, and some of y'all's may be a little bit different. They usually always have the same things in them, just sometimes they're in different places, okay? So this catheter right here tells me it's a cath tray, and it shows on here that it's a 14 French 5cc. So the 14 Frenches tell me how big that catheter is, okay? This is pretty standard that we use in most of our patients, but you're going to kind of eyeball your patient. Maybe they can go a little bit smaller, or if you can get someone that's going to tug on a little bit more, maybe something a little bit bigger.
Is it the length or the lumen, the size of the lumen?
The size of the lumen, how big around it is, okay? They're all going to be the same length for the most part, okay? So this right here, we need to drape our patient first. We've already identified them, done all that stuff. Get the bed up to a good working level. So just let them know that you're going to have to expose their private parts and that you'll try, you know, to be done as quick as you can. Provide for privacy, wash your hands, all that good stuff that you do every skill. Okay, that's high enough for me. So you're going to drape them the best you can, and you'll see some people not drape, but you want to maintain that privacy as good as you can. But then you also have to be careful that whatever you're using to drape them, that it's not getting in your way. So some people will kind of fold these covers around and kind of cover their legs. To me, I think if this is showing, I think that, you know, covering their legs for some people, it really doesn't matter. But you do want to get their legs propped up some. Spread them out as much as you can. Some of these people's legs aren't going to spread real far, so you may need to call in some help, okay? You will need a washcloth, and the other group took my washcloth, so there's a washcloth, okay? So you're going to do peri-care first. So you're going to come in, do peri-care just like you normally would. Put your gloves on. Let them know you're going to clean them up. While you're doing your peri-care, you're going to look to see if there's any kind of redness, any kind of skin tears, skin issues that you need to worry about. If it's something that you're concerned with, you're going to let the doctor know. So do peri-care just like you normally would. Get them all clean. You may need to go through different washcloths, you know, switching your sides. Y'all have done that before. Get done with your peri-care. Get rid of your towel. Dispose of your gloves. Then you're going to start to assemble all of your equipment. So everything in this package is sterile. You don't need that. I'm going to fold this down. This is going to be my trash bag. Okay, you want to kind of talk to your patient while you're getting all this. It's kind of embarrassing sometimes for them to be in this situation while you're getting everything ready and having it done in general. So your catheter or your kits are going to look like this. So they're going to be folded up, kind of a nice, neat package. Y'all's kits, this is what y'all are going to use whenever you skill, the ones you're practicing with today. So try to keep in mind where everything is in here. It is not going to fold back up the way that you take it out. So just work with it the best you can. So we can touch the outside of this. So I'm going to open this up. Then you'll kind of have to maneuver it around a little bit, and this happens. It's kind of like when you opened up your sterile gloves the first time, everything's kind of all over the place. And that's not going to stay probably. And then I'm going to go ahead and I'm going to scoot this towards my patient a little bit more. You want to make sure that you tell them to hold as still as they can. So that's going to work there. Okay. So my gloves are right here on top, so I'm going to reach in and grab, not tear that, grab just my gloves, come on, cover. This is where the sterile part starts, so you're going to make sure that you don't turn your back away from them or anything. Sterile gloves are just like y'all did before. Got your 1-inch quarter there. If your gloves that are in your sterile package don't fit, you can get your gloves that do fit and put those on. You just put them in your package. Nope, that may happen. I'm still good here. Alright, so I've got my gloves on. So now that I've got my sterile gloves on, I can't touch anything that I've used to drape my patient. I can't touch their legs, anything like that, okay? So in your kits, you've got two different types of drapes. You've got this little white one. It's kind of smaller. So what we're going to do with this is what they call a lay. And so we're just going to take that, and wherever it falls, it falls. Sometimes it's not going to fall in the exact same place. Sometimes one drape will be fine, or you can get your other one out. So that one is completely covering, but we're going to be able to move that kind of stuff around here in a little bit whenever I put this smaller one on. Okay, so this one's got the little hole right there, and so that's going to go right over top of our slate. So my hand is sterile, so I'm going to pull that one down a little bit. And so from the top, I'm going to find my area. I'm going to try not to touch anything or have your arms going over that. Sometimes it's kind of impossible depending on if your patient's moving or anything. That's why it's important to just let them know to stay as still as possible. So now we've got our trays. This here is kind of a two-part.
Go ahead and
here.
move that blue drape, Crystal, so they can see. Yeah, I can't film.
In the perfect world, this
There
is
you
what
go.
you're going to look like right here.
Okay, you're good.
Right there. Okay, so these trays have two parts to them. So I'm going to take this part out. I'm going to set it right there. So in here, in the bottom part, you've got a specimen container. Y'all aren't doing a specimen, so we don't need that. So inside here, here's your catheter. On the end, it's got the little hole that your urine's going to go through. This is little green port right here. This is going to tell you that this is a 14 French catheter, so it's always going to say the size, and it has on here 10 milliliters right next to that. So it's going to tell you how much fluid you're going to use to inflate your balloon. Okay. So if you're ever having problems with your catheter and you need to check, check place or anything like that, sometimes pulling the fluid out of here to see if you get back whatever's listed on here, sometimes that can be your first possible solution to the problem. So if you pull out and it's only got like 5 cc's, kind of scoot it back in there a little bit, and then you can put the other 5 in. Yes?
Do you always use fluid, or can you use air also?
Yeah, we use fluid, and the fluid's in our kits.
Okay.
Okay, and then the catheter bag is attached to that, okay? So that's that part. Now over here in this one, we've got our syringe that has our fluid in there. And then we've got our betadine solution. There's a tag that we really don't need. And then we've got our lube. So with the betadine solution, this one here doesn't have anything, so we would just pour this over our cotton balls, or some of them will have these little swab sticks that are already inside of here, and you'll use these to clean, okay? So different kits, different places will have different things, and there's always some little forceps in here, okay? So what we're going to do first is we're going to check and make sure that our catheter's good. So I'm going to pull that off. I don't need that. That should go in the trash can. So I'm going to attach this here, push it down in there good, and I want to make sure that this balloon inflates. Okay, so that's inflated, and whenever I do this, I don't have to put the whole tin in there. I'm just looking to make sure that it is getting bigger and that nothing is leaking out of that. If it doesn't blow up like that, then there's something wrong with the balloon, or if it's leaking, it's got a hole in it, then I'm going to need to get another catheter kit. Okay, so I know that's good. So I'm going to take that out. I'm just going to let that sit right there, okay? Now as far as cleaning goes, these here you won't, I'm not sure if you will open these in skills or not. I'll have to ask Miss Taylor what she wants to do as far as that goes. This here, you're going to pour onto there. Done with that. Okay, so then I'm going to take, this is going to be, let me rewind because I'm going to take this off. You have to have one dirty hand and one clean hand, okay? I am right-handed, but I like to hold my patient with my right hand because I have more strength in this hand. That way I can kind of hold them down and hold everything where I need it. You may need help holding skin back, holding skin folds back, that kind of stuff. So make sure that when you're cleaning your patient that you kind of see, Now, do I need to get somebody to help me, or can I do this on my own? Because sometimes you're going to have several hands that you're going to have to hold skin and skin folds back, okay?
Show how to take the wrapper off the catheter.
So this right here is, some people, you'll see, this right here, you just want to hold this. You want to hold it real smooth, okay? That way it's not flipping all over the place. So you're done with that, okay? Maybe, sticking. So I'm going to hold this in this hand, or I can go ahead and open up my lube and have it sitting in there. Okay? Any of these trays, you can put that in. I'm done with that. So this right here, you're going to make sure that you get plenty on there, on both sides, all the way around, okay? So that's going to, and you'll have to kind of work around a little bit to get everything to stay in your field, okay? So this hand right here, I'm going to take, this hand is now dirty. I'm holding this back. So I'm going to take, I'm not going to use all these dirty ones just because I don't want to get her nasty. So I'm going to clean, okay? And I'll talk to Miss Taylor. I was always taught to do the inside and then the outside. But I'll see if she wants you to do the outside last, okay? And there's a technique to that because, like Miss Lana was saying, sometimes you'll hear people say, did it wink at you? So you can clean the outside. Come in, clean this outside, come around, and then with this last one, if you have it good and saturated, whenever you clean your swipe down the middle, that betadine will kind of seal it over and then it will pop open. That's where people say that it winks at you. So you know that that's where you're going, okay? So then we're going to throw that away. So I'm done with that, okay? I've still got my hand here. I'm still holding it in place. So I'm going to get my catheter. It's already lubed up good. And I'm going to go straight into the meatus. And for a female, you're going to go in anywhere from 5 to 7 inches. By this time, you're going to start to see probably some urine come down through your tubing. And whenever I start seeing urine, I usually go in another 1/2 inch to 1 inch. That way I know that I'm in my spot, okay? So then that's in there. I'm going to grab my syringe. I'm going to inflate that. So all that fluid's in there. Disconnect that. Now I'm going to give it a little tug. Now on these here, they don't go up so far that when you tug it, yours will probably come out. So just give a little bit tug and that's going to kind of pull it down into place, okay? So then I can move this hand and all that sterile part is over. So I'm going to get some of this stuff out of the way. Trash can.
White House.
Uh-huh.
Do you only lubricate the length that it's going in?
I usually just do that very tip
Okay.
because I've got a lot of lube on there. So as that goes in, lube is going to kind of pull up right there and kind of carry that through that tubing on there. It's going to kind of saturate it really good. Okay, so that's in there. So ask my patient, how are you feeling? Are you feeling okay? You know, you just want to make sure that you're kind of talking to them and making them feel as comfortable as possible. So I've got that in there. I'm not sterile anymore. The catheter's in. So I'm going to take this. I'm going to pull this away. I'm going to get a napkin, do any kind of peri-care that's needed because they may have that lube kind of over their wavy a little bit, making a mess. So that's all going into the trash can. And since I've been touching them, I'm going to switch my gloves now because I'm going to have to get everything taped into place. At this time, they can put their legs down if you want them to. So I'm just going to put on clean gloves. My hands are sticky. Sticky and sweaty. Make sure that whenever you're doing this, you don't have a bunch of watches or bracelets or anything like that on, or they're liable to get nasty. Okay. So whenever you go to tape your catheter into place, some facilities will have what they call calf secures. And what that is, it's kind of like a big Band-Aid that fits onto their leg. And it's got a little latch on the top that this kind of clicks down in, and then you fasten it over top to hold it in place. So we're going to use tape. And I like to put one piece of tape down on their leg. It kind of keeps from having to take tape on and off of their skin, and that kind of stops that breakdown some. I'm going to put it about right there. So you need to look at their catheter. You want to make sure that they have room enough to where they can move around without it pulling real tight, because you don't want it to pull out or be uncomfortable. So you want a little bit of slack in there, but not so much that it's going to get hung on everything. You can tape it either up here. I like to tape it right here where this is the heaviest at, just because that way you don't have so much weight of these two heavier ports kind of weighing down on it. I'm going to put that right there. I'm going to move that one out of the way. I'm just going to put that tape right down on top of that other piece of tape. Just kind of save their skin a little bit, okay? Ask them how that feels. You know, sometimes if they have leg hair there or something, sometimes it might pull a little bit. So you just want it to be as secure as possible while also being as comfortable as possible. So I'm going to put them back down. Always cover them back up and give them their privacy as soon as you can. So one of the things we were watching for whenever we first put that catheter in was their urine output, okay? So we want to go ahead, hold this tubing down some and let it pull up down there and see how much you have to start off, because that's something whenever you go to document, you're going to put how much you had immediately back. Because if you put it in and somebody puts out 500 or 600 right off the bat, you know, that's important information. You know, they've been holding on to that urine for a while. So, do y'all know how to empty a catheter bag? Okay, so they're all kind of different. This one right here, we're going to pull down and out of this little port. We would put it over top of our cylinder, and this one just slides over. But then always make sure you slide it back and lock it. If not, you're going to have a mess later, or the person behind you is. Okay? So this right here is going to be kind of coiled down. This is going to attach to the bed sheet up here. And then this here you're going to attach to your rails. Okay? So then you're going to get all your stuff all the way. Ask how your patient's doing. Clean up all your mess. Get rid of all that. Take your gloves off. Make sure your patient's nice and comfortable. They have their call light in place. Make sure you let them know again, you know, they may have a little bit of pressure down there. It may feel like they need to use the bathroom, but that catheter is going to take care of it. You're going to lower their bed back down. I think I'm going up. Lower their bed back down. You know, make sure they've got their call light in place and let them know you're going to come in and check on them. So you need to be keeping an eye on their catheter bag, how much they're putting out. Sometimes you'll have doctor's orders that if they don't put out a certain amount within a certain time frame, that you need to call the doctor and let them know. So make sure you're checking that regularly and have good communication with whoever your assistants are or whoever else you're working with. Okay, so after you have them all settled, you're going to leave the room. You're going to document on your patient. You're going to document that you inserted the catheter per doctor's orders, what size catheter, this one was a 14 French, and that you instilled the correct amount of fluid based on your catheter size that you're putting in. You always want to chart how your patient tolerated the procedure, and that you'll continue to monitor, and that pericare was provided. Any questions?